As many of you know, suboptimal enrollment is the major challenge to conducting clinical trials. And in an attempt to overcome this limitation, many trials strive to recruit participants by inviting them through the electronic health record patient portal, which avoids some of the challenges of enrolling patients during their clinical visits. My name is Adil Parucha. I'm a gastroenterologist at Mayo Clinic. And on behalf of my colleagues, it's a privilege to present a sneak peek into this study entitled Factors Associated with Enrollment to a Decentralized Study, which is being published in the January issue of Mayo Clinic Proceedings. This study was supported by the Center for Individualized Medicine at Mayo Clinic. A Cochrane review of strategies to improve recruitment to randomized trials observed that the literature on this topic has plenty of variety but little depth. Only 3 of 72 comparisons in that review were supported by high certainty evidence according to grade criteria. And they conclude by saying that the methodology research community should improve the evidence base by replicating evaluations of existing strategies rather than developing and testing new ones. So we took that advice to heart and conducted in the Tapestry DNA sequencing research study, which aims to integrate the exome and phenome in 100,000 adults at Mayo Clinic. Before July 2022, over 50,000 participants were enrolled in the Tapestry study. We began the study within a trial in July 2022. In phase 1, we invited nearly 70,000 patients seen at Mayo Clinic with metabolic dysfunction associated steatohepatitis. These patients were invited to participate either through email or through the patient portal. And as you can see, the consent rates were significantly higher in the patients who were invited through the portal than by email. Then, in phase 2, we invited nearly 25,000 patients who had recently had a complete blood count for any reason at Mayo Clinic. And here, we not only randomized the mode of invitation, that is email or portal, but we also randomized the formatting of content. That is, some patients received an invitation with the standard content, essentially a consent form, whereas others received a more visually appealing invitation that had pictures and, as you can see, summarize the information in a more visually appealing manner. We found that 3.7% of invitees enrolled in the study, which is very similar to the corresponding rates in large biobank studies in the United States and in the United Kingdom. The enrollment rates were greater in patients who were invited through the electronic health record than by email, and also greater in people who received a standard text-only invitation rather than an enhanced, more visually appealing invitation. This was somewhat puzzling and contrary to our hypothesis, but indeed is similar to other studies which observed that the addition of audiovisual presentations to the informed consent process made little or no difference to the participation or willingness to participate in a clinical trial. And finally, the enrollment rates were also greater in women than in men, in white or non-Hispanic or non-Latino persons than other racial categories, in urban than in rural participants, and in patients who were older than those who are younger than 49 years. The frequency and timing of interactions with the healthcare system also affect enrollment, and patients who had more encounters reflecting more contact with the healthcare system were more likely to enroll in the study. So to conclude, These findings suggest that the enrollment in large decentralized studies may be optimized by inviting participants through the electronic health record than by email. Enhanced display of invitation materials did not increase enrollment rates in this study. Clearly, these findings need to be confirmed by other studies, which should also research ways to improve enrollment in men, younger patients, and non-white and or non-Hispanic patients. I hope you enjoyed the appetizer and are intrigued and enjoy the main course in the journal. Thank you for listening.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.